actor, politician Kamal Haasan joining me from Chennai. Thanks very much for being on the show, sir. Tell us first, of course, Tamil Nadu, unfortunately, now is the second state to have crossed 1 lakh cases in India. Cases are rising there in a spike as well. You started a new initiative, Save Chennai. Why do you think this was needed at this time, and what went wrong in Chennai and Tamil Nadu?
I think lack of transparency and mismanagement. I think it's too late to talk about mismanagement. So we've all moved into managing the situation to the best of our capabilities as citizens, because this would have gone much better if the government had been keen on citizen participation. Some of the states who tried it have succeeded around the world and in India. So I don't know what was the reticence, but we're paying with human lives, and that's not acceptable.
The loss of human life is not acceptable. What do you think, Mr. Kamal Haasan, is the real issue? You said lack of people's participation, but we had seen that earlier Mumbai and then Delhi had a bad time with shortage of ICU beds, shortage of hospital beds. What do you think is the specific issue that people of Chennai are facing now as regards to medical care and hospitalization?
See, shortage of beds are going to be there because you're not prepared. They did not take control of private hospitals. The government could have done that, and they would have helped because of the good profile that it give their hospital post-COVID. So all would have been helpful. There are so many buildings, including my own building, that is our party building, was offered. It's not lakhs of square feet, but it is good enough. It has a lot of space, and I said anything for the government to use. And the only reply I get is they stick a COVID notice on my building. So that's all. I mean, it was a knee-jerk kind of reaction. But we can't blame them, because around the world, even during the Spanish flu or the plague, the governors of the cities have always come up with nothing is wrong. Who, me? No, everything is fine, kind of a thing. And so I think we've just stupidly repeated history.
And of course, at a time of a pandemic, we also realize that how little our politics actually focuses on health. In fact, luckily, Tamil Nadu's health infrastructure is much better than many other states of the country. Perhaps only Kerala rivals it. You have a very good local healthcare system in your state. Where is the lack of coordination that we're not seeing that health infrastructure really coming to the fore at this moment?
Yeah, when I spoke to the Kerala minister, the first envy the health minister, Madam Teacher, had was that you have a better infrastructure than Kerala. We envy you for that. And that's what we have done. We have extraordinary infrastructure, which we didn't put to use. Apathy.